Okay, so hello and welcome to Health in Europe. This is the rescheduled session with Professor Tamara Hervey and Dr. Sabrina Röttger presenting their work on the Lex-Atlas COVID-19 European Union report. So Tammy and Sabrina, please, the floor is yours.
So it's my job to start, so I'll get going. Thank you very much, Mary, for inviting us to participate in Health in Europe. These sessions have been an absolute lifeline during the pandemic, for me personally anyway, and I think for many of us. It's been fantastic to see people, people's pixels in a little box on the screen. It's been fantastic to stay connected and to make some new connections. So thank you very much. So this afternoon, we just want to tell you a little bit about the work that we have been doing together for a bigger comparative health law project, which is known as the Lex-Atlas COVID-19. Shall we go to the next slide? So what is the Lex-Atlas COVID-19? Well, as Solvita was already advertising, it's a collection of independent reports written by nearly 200 very high quality scholars, and I'm including Sabrina in that, perhaps not myself. That would be too much self-promotion, from across the globe. It's peer-reviewed legal analysis. The peer review process is pretty thorough. So our experience of that has been an extensive response to our initial drafts, half of which we have had back and have responded to, and the other half of which we're still waiting for. So it's properly peer-reviewed legal analysis. It's trustworthy. And it is also a genuine comparative law resource, because each entry is written using what's called the author guidance code, which is a set of headings and questions that each author is asked to answer about how the jurisdiction that they write about responded legally to the COVID-19 pandemic. And that means that it is creating all sorts of really useful data for future and current researchers to compare legal responses, and then they can be compared against public health outcomes. The Lex-Atlas is completely open access. This is because of various bits of funding, but also partly because Oxford University Press was happy to allow that. And it's published formally by Oxford University Press. So again, it's a very high quality place to be published in. In general, each report is on a country, but we were approached to write about the European Union, which is obviously not a country, but is, at least in our view, a jurisdiction. So should we go to the next slide? So when we first started thinking about this, we thought, well, there isn't very much EU law on the COVID-19 pandemic. There's loads of policy perhaps, but there's not much law at all. But then the more we thought about it, the more we realized that actually there is a lot of law, and that it is really important to try to capture that law, what it is and was, how it unfolded, and to do so within the analytical structure of the questions that you might ask about the law of a state. And these are some of the areas that we ended up talking about in our report. I think that's the end of my turn.
Okay, thank you very much. Well, let me see if I can click further. Okay. So what we want to do kind of in the following with this presentation is not to now go into too much of kind of the granular detail of each and everything that the European Union did, because that's a bit overwhelming, and B, probably also not very exciting for all of you. We will give a little bit of little snapshots of certain policy areas and what has happened. But what we would like to do actually with the remainder of the presentation also later on is to enter into a discussion with you to develop a little bit of thoughts on how to actually now normatively think about all of these responses, because that's something that we haven't done yet in the report itself, because that was very in that sense very descriptive, let's say, because it's an account more than a deeper analysis of that in higher normative frameworks. Now, to take you back, and I think we all don't want to go back, but to take you back into the start of the pandemic, what we saw then within the European Union in times of the pandemic outbreak was very much uncoordinated, divergent, dispersed responses by member states. The motto that you heard through all of the news basically was trying to flatten the curve. Very quickly, all member states introduced some forms of social distancing, also there with various policies. And various mixes of measures. Something that we as Europeans, and especially people that like me live in the border region, were really not used to anymore were border closures, which was a very different reality from how our life looked before the pandemic. And what we also saw to a certain degree, shockingly, was also, especially in initial stages, the lack of solidarity between the member states. If we think back to calls from Italy to other European states to ask for support in terms of supplying of PPE and so on, all of those not so nice responses to the pandemic that we saw. And that actually then led to the EU's attempt to really coordinate these measures more. And this is kind of also, or this is the line that we see, that we notice, the red thread that we notice throughout the COVID responses in various areas, be that public health measures, be that the question of traveling and so on. The most important role that the EU played within the COVID pandemic towards its member states was really the attempt to coordinate the member state measures and to try to find kind of a common denominator. That can, of course, be reattributed, and I mean, this is something that we can also discuss later on, but it can be reattributed to the quite constrained formal legal competences of the European Union in terms of public health. And also, especially in the beginning, also the lack of political will amongst the member states to act more in solidarity and in a more coordinated form in that regard. So basically, what we had to repeat over and over again in the report was that actually, when it comes to public health measures, most of those were not taken on EU level in a coordinated, harmonized form, let's say, but were actually taken by individual member states. What the EU then did, and the general approach there was very much to focus on trying to coordinate these measures as much as possible, and also to share information and to provide scientific advice to the member states in this ongoing, at that point, still quite drastically unraveling crisis. What is notable in that sense is then that the EU actually adopted very few legally binding public health measures. And those mainly in the context where it has strong competences, and that is the internal market. It mostly relied on guidance and other forms of soft law, be that issued in the form of commission communications or agency guidance, and the ECDC is very prominent in that regard. So this is kind of the overall picture that we received. There's a link to the timeline included in the slide where you can kind of look at the individual actions if you want to. Now, one area that is where we had quite pronounced EU activity, which of course has to do with the fact that we're talking about a constitutional freedom in the European Union, was the free movement of persons. So we are in a context where the free movement of persons generally is quite elaborately protected by the treaties and also by secondary legislation. And on top of that, we have the Schengen Agreement, which kind of removed border controls in the member states that are part of the Schengen Agreement. And here, what we see is that basically what this framework did, it imposed conditions on the member states in order to regulate when borders can be closed or not. So there is the possibility to take national measures based on public health protection. However, those closures of the border always had to be, on the one hand, proportionate, and then also had to be conducted through various procedural safeguards. However, this all apparently wasn't that big of a hurdle for the member states, because in March 2020, at the height of the outbreak of the pandemic, we saw that basically all EU member states closed their borders and reintroduced border controls. The EU responded to that by mainly soft law measures, which is actually really surprising because this is an area where the European Union would have competences to actually take legally binding measures on the matter. And what we see here then is that we had, first of all, the joint communication already in April 2020, where they tried to envisage how to reopen the borders again. And then in summer or fall of 2020, we have council recommendations which established a framework that we are actually still operating under, basically, and that is that the just individual restrictions on travel into the specific countries and into the European Union as such from third countries now then has been subject to a framework constructed by these recommendations, which is based on an analysis of the status, the pandemic outbreak status, let's say, of the countries from which people would travel. That concerns EU countries, but also third countries. So here then we see EU harmonization via these soft law measures to set common criteria of when it would be acceptable to restrict the travel from one country of the EU or a third country to an EU member state. So here there are still individual national measures that are taken, but the framework in which they operate is harmonized via these recommendations, but by soft law. The overall feeling we see in the literature, and this is something that definitely still needs to be kind of in detail studied in empirical research, is to see whether the member states have actually really followed the council recommendations. But this is something that we couldn't do in our report here. That wasn't the task for us. Finally, then, I mean, the most current response in terms of this traveling is something that we have gotten used to already now. That was the introduction of the digital COVID certificate, which basically then frees people who have the digital COVID certificate, so they are vaccinated, recovered, or could show a valid test. And those were then free to actually travel into EU member states without further restrictions such as quarantining and so on. That was one of the few actually legally binding measures that we saw in the European Union. When it comes to public health measures, so the question, did the EU say anything about lockdowns, school closures, and so on? The answer to that is that there has been no legally binding public health measures because obviously the European Union doesn't have a competence to do so, to order a lockdown or school closures or anything like that. So these public health measures were a matter of national or subnational competence. However, the EU did play a role in this, actually. We see that there has been a lot of soft law and scientific advice also on the question of whether lockdowns are necessary, under which conditions, how to deal with school closures. And all of that has been addressed in quite extensive ECDC guidance. So when we were first confronted with this heading in the Lex-Atlas, we thought, well, okay, good, this is a 2-sentence response. The EU can't do anything in this regard. But it became really clear that in order to secure, on the one hand, the human health protection, but still also the well-functioning of the internal market, there has been involvement of the European Union when it comes to recommending member states how to proceed in terms of lockdown, school closures, and so on the basis of scientific data and risk management measures, you can basically also say, in terms of the ECDC guidance and then the more horizontal Commission communications that we saw throughout the pandemic. When it comes to medical devices, so PPE and testing, I mean, it's not up to the European Union, of course, to order the citizens to wear protective masks or something like that. So also there, at first we thought this is a quick response, but then actually we had more to say about medical devices, and that was that the European Union was very much involved in making sure that we have enough of those medical devices at our disposal in the member states. The first thing they did was lifting the, at that time, then existing national export bans and imposing a common export authorization requirement to third countries. So to make sure that there is free circulation of PPE within the European Union, but also attempting to keep as much of the materials as possible under control within the EU and only exporting those types of materials where this can be justified on the basis of the stock that was at the disposal of the EU at that time. There has been joint public procurement and also EU-financed stockpiling of personal protective equipment and also tests. And we also saw that the European Union lifted some of the regulatory barriers that medical devices face when they want to enter the market. So the one big move here was to postpone the application of the medical device regulation for some time, and also to lift some requirements with regard to CE marking and conformity assessments in that regard. And then again, what we see here is Commission guidance in consultation also with the ECDC on testing strategies. We saw coordination of testing strategies in the Health Security Committee, and also the mutual recognition of test results, which kind of presupposed that you had common criteria for the development of these COVID tests. So again, not the activity we expect from a member state in terms of requiring people to wear masks and so on, but still a lot of activity on behalf of the European Union. Well, vaccines and treatments, that is also something that the European Union was very much involved in. On the one hand, quite surprisingly, actually, already in June 2020, coming out with a communication on the EU strategy for COVID vaccines by the European Commission, which attempted to prepare the EU member states for the launching of potential vaccines. At that point in time, we weren't even sure we would see even one. Luckily, that has come to a very good fruition, these efforts, because by now we have 5 vaccines approved within the European Union. And then we saw that the European Union was, or the European Commission instigated advanced purchase agreements with regard to the vaccine suppliers. One thing that we can discuss a little bit about was the regulatory flexibility that was introduced when it comes to the authorization of the COVID vaccines. But overall there, we also see how important actually the role of the European Medicines Agency was in that sense, in making sure that we still have a relatively speedy assessment of the vaccine authorization applications, to make sure that there's coordinated pharmacovigilance, so post-authorization surveillance of the measures. And then actually in May 2021, we also saw again the Commission adopting an EU strategy for COVID therapeutics, because that was lacking at that point in time still. We now have a couple of therapeutics authorized. But in essence, this is not just a policy document, but in essence, it came with a whole lot of money to be invested into the research into COVID therapeutics. So in that sense, a lot of activity also in this area by the European Union. I quickly hand over to Tammy for the following slides.
So then there's a whole big part of the author guidance code that is basically about, well, what did states do to promote, legally speaking, what did they do to promote economic recovery? And here again, we actually have quite a lot of European Union activity. Some of this has been quite controversial. On the slide here, we have some of the key elements in terms of EU spending. So emergency support instruments like the SURE instrument in terms of providing co-finance for employment support at national level. And we have the very widely reported European Recovery Instrument within the Next Generation EU umbrella, if you like, whatever you want to call it, and the refocusing of the European Union's existing cohesion funds. And there were some other small funds that we also found that were kind of refocused as well. Of course, you know, this is not harmonization. It's not that type of EU law, but it's all legally created because of the European Union being a body of limited competences. And then the other strand of law that helped the economic recovery was the European Union encouraging its member states to use to the maximum the exceptions to the normal stringencies of market rules. So relaxation of state aid rules was a very obvious move for the European Union to do. And also the European Union removed the budgetary obligations under the Stability and Growth Pact pretty early on in the pandemic. Just one more slide, I think, from me before we can move towards the discussion part. there's a whole part of the author guidance code in the COVID Lex-Atlas about human rights and vulnerable groups. And again, this was in the category where when I first saw the heading, I thought, well, this is going to be kind of a couple of lines. Mainly, this is a national competence. But actually, although there isn't any hard or binding law per se that was adopted newly to deal with the pandemic, there was a surprising amount of activity. So an awful lot of the ECDC guidance and some of the Commission guidance that Sabrina was outlining a minute ago also refers specifically to vulnerable groups. So to give just one example, the ECDC guidance on social distancing measures, which was originally adopted in March 2020, so really early on, explicitly mentions the need to offer extra support to vulnerable people. And it mentions the elderly, people with disabilities, homeless people, undocumented migrants and prisoners. Another example is the ECDC's guidance on what are called non-pharmaceutical interventions, which has explicit sections on prisons and detention centres for refugees. So there was attention to vulnerable groups and their particular needs right from very early on. The European Commission, as well as the ECDC, was keen to make sure that vulnerable groups appear in its policy documents. So the July 2020 communication on preparedness identifies 3 categories of people whose needs need special protection. So medically vulnerable people like the elderly, socially marginalized people like people in crowded accommodation situations, and members of professions which entail close proximity to COVID-19 sufferers. So principally medical professionals, but also long-term care professionals. Also, the European Fundamental Rights Agency was pretty active from fairly early on. It issued a number of bulletins on the pandemic, which, again, they don't have any legal, they're not formally legally binding, but they indicate the approach to interpretation that the Fundamental Rights Agency might take in this context. So one of the things that we probably need to do at the next phase of this research is to think through what this means in terms of interpretation of the binding legal texts, and also in terms of the obligations of the European Union institutions to comply with the European Union's Charter of Fundamental Rights, and the obligations of member states to comply with the Charter when they are implementing EU law. So yes, that's the key point to make there. As with all other jurisdictions, there was an approach that involved balancing the civil rights to free movement, to privacy, with the right to health and human health protection, and indeed the right to life itself. Okay.
All right. Then we actually already, after having given this little overview, these little snapshots of the EU response, would like to move to a couple of points for discussion. The first thing we want to mention in that regard is, we have some of the authors here today, so that's an absolute privilege, of course, then. But already quite early on in the pandemic, Kai Porenhagen, Anik, Mark Fleer, Tammy, and Alexei Hervey wrote an article on making clear that actually it's funny that I'm paraphrasing this when everybody's in the room, but in the end, basically that although the health competences of the European Union are constitutionally quite limited, looking at Article 167, sorry, there we go. If you look at the whole of the EU's competences and also the there's actually very, very much that the European Union can do in terms of these type of health emergencies. So basically taken as a whole, if you look at EU competences, for example, when it comes to the free movement of persons, right, there was a lot of involvement in the pandemic, and it had an impact on in how far national measures in order to limit the spread of the virus via border closures, for example, could be taken. So actually, there is a whole web of competences. If you look at the more finer lines of soft law governance and maybe things outside the direct remit of EU health competences, there are powers that the European Union has and can use, and as we have found in this report, also does use in order to address health emergencies like the pandemic we've witnessed with COVID-19. Having said that, there are some notable things when it comes to using these variety of powers that we have noticed, and that is that what we quite clearly saw in all of the responses that we kind of mapped for the Lex-Atlas project is that the COVID response very clearly was a matter that was driven by the executive of the European Union. And that is, on the one hand, the European Council, especially in terms of political guidance and questions of free movement of persons, for example. But then most pronounced, of course, the European Commission with various initiatives and soft law measures and the communications that they issued quite regularly. And then also counting EU agencies into this executive definition, they had a tremendous impact on the EU response, or a tremendous role in the EU response with regard to the COVID vaccine, be that COVID pandemic, be that the EMA with regard to the vaccines and the therapeutics and the post-market surveillance of those as well, be that the ECDC. But what is really, really notable is that the legislator as such, and especially here we're also thinking about the role of the European Parliament, has been far less pronounced in that regard. Not to say that they are inactive, but in the measures, the laws and policies that came into fruition, we really see that there is little legislation as such. So in that sense, this is really kind of limited to, for example, the COVID certificate, their activity in the recovery plan. But a lot of those measures are executive measures that are taken either in the form of communications or delegated and implementing acts by the European Commission. So a very clearly executive-driven response. Then what is really clear also from the report and the mapping that we have conducted is that what the European Union has done and what it has, in the past also built its strength to do was to provide scientific advice and to use science as a cornerstone for the coordination of measures. And here we do also see that the ECDC has risen to kind of unknown strength in that regard, in the sense where we see that their guidance was A, very extensive, and B, very detailed, and also really went into an area that could already be considered risk management, which at that point in time was something that they were not mandated to do per se. So we do see here that we, again, and this is something that's really common in the European Union actually, that in the face of diverse responses by member states to this type of crisis, what the European Union did in a lot of its policy measures was to call back and to ask the member states to refocus on science, on a proper, as good as possible assessment of the situation in order to take their measures. And the ECDC in that regard then was also very active in providing base level science that member states can rely on. That goes hand in hand with another phenomenon that we notice, and that is the extensive use of soft law. So we see many policy-specific soft law documents. There were the Commission communications like the joint roadmap towards lifting the COVID containment measures, for example, but also the Commission communications. And within the Commission communications, there's actually one that stands out a little bit, and that was the staying safe from COVID during winter, the one that was adopted at the end of 2020. Because that actually also uses a quite imperative language, given that this is a soft law document. So there are sentences in there saying decisions must be taken in a coordinated and targeted manner, or in the current epidemiological context in the EU, it is difficult to justify lifting control measures. It states that the Commission strongly encourages member states to consider this guidance. Booster campaigns need to be put in place immediately, and so on. So there was really extensive use of soft law, and of course that raises questions, because soft law is a very good fallback mechanism in terms of crisis, because it's quickly adopted, so to say, without going through the whole legislative process, of course. But that also raises, of course, questions of the legitimacy of these type of soft law documents, and accountability for them as well. And on the other hand, then it raises questions on efficiency. And as we said, we looked only at the EU level. But I think a big task after we finally finish the pandemic and overcome the pandemic will be to look into how effective the governance by soft law actually has been, and whether or not it kind of gave the effects that the European Union was longing for. The final point, and this is just very quickly, of course, the immediate response to this, well, in the EU self-assessment, if you look at, for example, the lessons learned from the COVID pandemic from the Commission and so on, this successful response to the pandemic was that there was also a call to for further integration in terms of health law and policy in the European Union, and the call for the European Health Union. Now, I think at this point in time, we are a bit clearer on what is feasible in terms of the European Health Union, and that is, and that's my personal judgment, so that's up for discussion, but that's not very much, because the proposals that we have seen so far are very emergency-based, very much under the impression of the COVID pandemic, and actually most of the things that we see are codification of kind of practices and mandate extensions of agencies, for example, that we already saw acting like that during the pandemic. So actually, this is not as revolutionary as maybe it could have been. All right, good. So I think that was the end of the presentation. In essence, we would just like you to invite you to share your impression of the EU's response, and maybe you have something to say when it comes to the discussion points and your impression on how the EU has responded to the COVID pandemic. Thank you very much.
Okay, thank you very much, Sabrina and Tammy. I'll just stop the recording.